Hello, my name is Manuel Ayala and I will be performing an assessment on my patient today. It's going to be about the thorax, the lungs, and the cardiovascular system. Before we begin, can you please tell me your first name and last name and your date of birth?
Rebecca Cuevas, 4/29/1988.
Perfect, so now I'm going to perform hand hygiene. Okay, so the very first thing that we're going to do is we're going to be inspecting the chest cavity. So what we're looking for is for symmetry, to make sure that there's no retraction, that there's no labored breathing. Do you feel short of breath?
No.
Perfect, as I can see, Rebecca doesn't have any abnormalities. It's symmetrical and also as well from the back. Okay, so now I'm going to go ahead and have the patient lay down and I'm going to be palpating the chest cavity and I'm also going to be percussing. So at this time, I do have my gloves on and I have performed hand hygiene, so now I'm going to be palpating the chest cavity. Do you feel any pain?
Mm-mm.
Any pain?
No.
Any pain?
No.
Okay. So what we're looking is we're inspecting for any masses, any abnormalities, any tenderness. The patient denies tenderness at this time, and I didn't feel any masses. So now we're going to be percussing. So the way that we percuss is that we use the middle finger and we tap it. So now I'm going to tap, okay? Okay, go ahead and sit up. And I'm gonna scooch a little bit to the front and then over here, please. Okay, so now I'm gonna go ahead and do that to the back as well, and I'm also gonna be checking for tactile firmitids. And this is just using this part of our hand, which is like bony prominences, to check for the vibration as the patient says 99. So I'm gonna first do the tapping, and then when I tell you to say 99, you're gonna say 99, okay? Okay, say 99.
99. 99. 99. 99. 99. 99. 99.
Okay, so now the last thing that we're going to do is we're going to be auscultating the lung sounds. We're going to do both posterior and anterior. I'm going to start with the back, okay? When you feel my stethoscope, just go ahead and take a deep breath. Okay, so now I'm going to go ahead and do the front, okay? Okay, perfect. Do you feel any shortness of breath? Okay, so I listened, everything sounded good. No diminished lung sounds. The patient wasn't breathing with any labor or using any accessory muscles, as well as everything was present. I didn't I didn't hear anything abnormal, so that's good. So that would conclude our thorax and lung assessment. So now we're going to do the cardiovascular assessment, okay? So similar as the other one, we're going to go in the same order. We're just going to be checking for, we're going to do inspection first, then we're going to do palpation, percuss, and then we're going to go ahead and listen to your heart sounds, okay? So very first thing, we're going to look at the patient, make sure that they're not in any distress. This patient is not in any distress, and at this point we would check the vitals, so which is the blood pressure and the heart rate. I do not have a blood pressure cuff, so I'm going to go ahead and just assess for the heart rate. So hand hygiene as well. So I have my clock over there, so I'm just going to go ahead and check for your pulse, okay? Okay, so my patient's pulse was 64, so now we're going to go ahead and do the rest of the assessment. So the very first thing that we're going to do is we're going to start from the neck down. So we're going to go ahead and take a look at the patient. So if you could just sit up to the side, I'm going to put a pillow behind you. And this is just to assimilate that it's like about 30 to 40 degrees, excuse me. So the reason why the patient needs to be in 30 to 40 degrees is because we're going to be checking for jugular vein distension and jugular venous pressure. So if you can go a little bit over here. Yeah, there you go. So now you're going to go ahead and take a look to your left. And then just relax. There you go. So we're looking for the jugular vein distension. So this Rebecca doesn't have any distension. So now we're also going to be looking for the jugular venous pressure, which is usually a topic of the right atrium, and then it's the distance from here to the mid-clavicular. It should be between 6 to 8 centimeters with water. If it's greater than that, it's usually typical because of CHF or any other cardiac abnormality. Okay, so now you're just going to take a deep breath, hold it, and now bear it down like as if you're going to go to the restroom, like push. Okay, you're going to push, but with your breath still hold.
Oh.
Okay. Okay, do it again. Hold it, and then push. Okay, now relax. So I could see that the vein popped up a little bit, and it deflated, and everything's good. But the central venous the jugular venous pressure that I would estimate for Rebecca would be less than 6. Okay, so now go ahead and face this way, please. Okay, so now I'm gonna go ahead and listen to your carotids, and then I'm going to palpate your carotids, okay? So what I'm trying to listen here is if there's any bruits, and we use it with the bell side of the stethoscope. Perfect. There is no sign of bruit, so now we're just going to go ahead and feel them. So now there's no signs of a thrill, and it's a +2 on both sides. So now we're going to go ahead and move down. So now we're just going to look at your chest cavity. So the same thing, I'm just going to take a look right here on your left side, and I'm going to feel where your heart is to see if there's any pain, tenderness, or any abnormalities, okay? Any pain? Okay. So now the next thing that we're going to do is we're going to also check for the for any heaves. So I'm going to put my hand right here and just breathe. Okay. So now the next thing that we're going to do is we're going to be checking for the apical pulse, which is going to be in your fifth intercostal. So it's going to be, my bad. So now the next thing that we're gonna do is we're gonna just auscultate the heart sounds. We're gonna use both the diaphragm and the bell. We're gonna do 2 rounds of each, and this is to assess for S1, S2, as well for any additional problems such as murmurs, gallops, and for an S3 or S4 if indicated. So we'll start with the diaphragm, and we're gonna go ahead and start with where the apical pulse is at. Same thing, okay?
Mhm.
Okay. So now that I've assessed for the heart sounds, I did hear the S1 and S2 and all the heartbeats, and then as well I didn't hear any additional beats such as gallops or murmurs, and everything seems like everything that I assessed was normal and within normal for the patient. Do you feel any chest pain, any shortness of breath?
No.
Perfect. So this would conclude my assessment for the thorax, the lungs, and the cardiovascular.